The following materials will be needed for blood collection from the canine patient: a clean set of clippers, isopropyl alcohol, cotton balls or 4x4 gauze, appropriate size syringe and needle, 22 or 21 gauge needle, appropriate test tubes. To begin, carefully place the patient on the exam table. If you are working with a larger breed dog or a patient that is difficult to work with on the table, then you may choose to work on the floor. Thoroughly wash your hands prior to working with the patient. The peripheral veins that we will be discussing include the cephalic veins and the lateral saphenous veins. For both of these, your assistant will need to stand on the opposite side of the extremity being used. The cephalic vein is located on the forelimb of dogs. It traverses along the front edge of the forelimbs, as shown here, and is very easy to access. When using this vein, the patient is allowed to maintain a position of comfort. In most cases, the patient will be in sternal recumbency. With one arm, the handler controls the head, and with the other they should control the dog's leg, as demonstrated here. The technician may opt to clip a 1-inch square of hair around the venipuncture site to allow for easier visualization and access to the vein. The handler secures the patient's elbow and uses their thumb to occlude the cephalic vein. If a rubber tourniquet is used, the handler should still control the elbow in case of sudden movement. You will next want to wipe the area around the vessel clean with isopropyl alcohol. Firm cleaning of this area with alcohol will not only clean the site, but it will also help to further define the location of the vein. Gentle palpation of the cephalic vein with your finger should be performed until you are confident of its location. If the vein is difficult to see, try pumping the patient's paw, as shown here. This will usually raise the vein so that it is easier to visualize. Once you have located the engorged cephalic vein, break the suction seal created between the syringe hub and the plunger by gently pulling back on the plunger. Then replace the plunger to its original position. Insert the needle of the syringe into the skin and vein at a 30 to 45 degree angle, making sure that the bevel of the needle is facing upwards. You will need to gently redirect the tip of the needle down the vein as it enters. It is not uncommon to see a flash of blood in the hub of the syringe and feel the needle pop through the vein as you enter the vein. Slowly pull the plunger of the syringe and fill with the required amount of blood. It is important that you avoid using excessive force or being too rapid, since this can cause the vessel to collapse and prevent aspiration of blood. If blood is not being aspirated, palpate the vein again and try to reposition the needle without pulling it out of the skin. If the vein is wobbly or readily moves around beneath the surface of the skin, you may benefit from stabilizing the vein with your thumb. If you are repeatedly missing the vein, you may want to seek the help of someone more skilled at drawing blood. After the desired amount of blood has been collected, release pressure on the vessel or remove the tourniquet before retracting the needle. This will decrease the incidence of blood leaking into the tissues from the punctured vessels. The assistant should place direct pressure over the venipuncture site for a few minutes. Collecting a sample from the saphenous vein is very similar to using the cephalic vein. The main differences are in positioning the animal and how the handler restrains the animal. For this procedure, the patient will need to be placed in lateral recumbency. Have the assistant reach over the hips and hold on to the leg just distal to the knee. By placing pressure against the tissue in this region, the vein can be occluded as it passes behind the stifle. If needed, shave a 1-inch section of hair around the saphenous vein and then clean with isopropyl alcohol. This vein is normally larger and easier to see than the cephalic vein. However, the saphenous is often unstable and tends to shift underneath the skin easier. Venipuncture, blood collection, and post-injection care are the same as described for the cephalic vein. You will want to re-examine the blood collection site after a few minutes and before releasing the dog to the pet owner. Examine for continued bleeding, excessive bruising, or hematoma formation, which may require placement of a temporary bandage. If a temporary bandage is placed, the pet owner will require specific instructions on monitoring the site for further bleeding, when the dressing can be removed, and what they can do if bleeding reoccurs. The following are some final points to remember when drawing a blood sample. Any animal with a potential clotting disorder should have blood collection performed by the most experienced person, and the smallest vessel available should be used. Repeatedly missing the vein creates unnecessary pain, potential bleeding, and additional tissue artifacts that might distort the sample. Be careful to use an appropriate sized needle for the patient you are working with. The smaller the needle used, the slower it takes to retrieve the sample and the greater the chance for the sample becoming hemolyzed. A hemolyzed sample can affect the test results. If the needle is too large, the chances for prolonged bleeding and hematoma formation become greater. As recommended earlier, a 21 or 22 gauge will be used for most canine blood collections.